Hi friends, good afternoon. Today we are going to discuss about the prioritizing. Among the NCLEX rule, the prioritizing plays a very important role. Here we are going to see the ABC priority. As we have discussed earlier, airway, breathing and circulation plays a very important role when discussing the NCLEX type questions. We should always choose airway first, and we should ask the patient whether the patient is able to breathe. So there are many red flags such as choking, stridor, wheeze or drooling. Drooling might be because of any tongue swelling, or if the patient is having any inability to speak because of the swelling. And we have to also assess the loss of consciousness, which affects again the airway. Next, coming to the breathing, here we have to assess if there is an oxygenation is adequate to the patient or not. So the red flags here is we have to see the respiratory rate. It should not be less than 10 breaths per minute, or it should not be more than 30 breaths per minute. We have to also assess the saturation of the patient. It should not be less than 90% of saturation SpO2. And we have to see for the cyanosis. Cyanosis is another indicator for inadequate oxygenation in the body tissue. Then we have to see if the patient is using any accessory muscles such as the sternocleidomastoid mastoid muscles or the abdominal breathing. So we have to see if the patient is using any accessory muscles for his breathing. And along with this we can also see any chest retractions are also present if there is any compromise with the breathing status. So here the breathing problems comes utmost priority when compared to the circulation, so it has to be taken care of. The next the third one is the circulation, where here the red flags is we have to see for any severe bleeding. If it is from the major vessels, it has to be monitored and has to be intervened at the quickest, because the patient we might be losing the patient because of hypertension. So we have to assess for any weak or the absent pulses, and we have to see the immediate shock of signs of shock. Mainly it might be tachycardia or weak pulse, or the patient is having very cold and clammy skin. See, these are the signs of shock. And we have to see any other problems such as chest pain or any instability in the patient, which can again be a compromise of blood supply to the heart. Here we have to see the NCLEX test taking rules. Like ABCs comes the first, that is the airway, breathing and circulation, and next comes the Maslow hierarchy, where the physiological needs goes first, and last will be the safety. So, and again coming, the actual problem will be given priority over the potential problems, and the physiological problems are given the most importance rather than the psychological aspect. And the unstable patients are considered to be most critical when compared to the stable patients. Here I am going to give you an example where which patient has to be seen first. If the patient is having a stridor and hoarseness, and another patient is having a pain of scale of 8 out of 10, here the priority goes for the airway. So the airway beats the pain. So we have to assess the patient with stridor and hoarseness first rather than the patient with the pain. And next example is the patient with having respiratory rate of 8 breaths per minute after an opioid use. And next patient is who is anxious about the surgery. Here we have to concern the patient who is having the respiratory problem. Here we can see that the breathing beats the anxiety. So the physiological problem comes priority when compared to the psychological problem. Another example is patient with an active GI bleed and another patient with mild hypertension. Here the circulation beats over the chronic illness, But the hypertension is a chronic illness and the patient is not much necessary to be intervened, whereas the active GI bleed might cause the patient hypertension and the patient might go into shock. So we have to have a quick memory. The patient who cannot breathe, nothing is mattering more. So we have to always first assess the respiratory status. Okay, thank you friends.